Depression. Do you have appetite or weight changes? Are you feeling persistently sad, anxious, or empty? There is a good chance that you are suffering from depression. There are also other possible symptoms you can notice on yourself: poor concentration, hopelessness about future, disrupted sleep, feeling tired or low energy, and you even may be thinking about dying or suicide. No matter what, do not commit suicide. You have many ways to get out of depression. Eat healthier, do some exercise, talk to someone who understands what you are going through, but most importantly, seek help from your doctor or psychiatrist. Depression is quite a common disorder, so don't worry, you are not alone. According to the World Health Organization, about 280 million people worldwide have depression. That's 3.5% of the population. Post-traumatic stress disorder, PTSD. Post-traumatic stress disorder is a mental health condition that can be developed if you experience or witness a traumatic event. There are some examples of traumatic events that you should avoid if you don't want to suffer from PTSD. Combat or military experience, physical or sexual assault, car crash, natural disaster, health problem or injury, witnessing violence or death, and childhood abuse. So how do you know if you have PTSD? You probably can't sleep really well because of the nightmares about the traumatic event. You often feel or act like the event is happening again. You are trying to avoid thinking or talking about what happened. You don't want to do anything that is reminding you of the traumatic event. Drinking is your favorite activity right now. Happiness is a distant dream, while anger and aggression have become your constant companions. You don't need to suffer from PTSD your whole life. Find help from your doctor or psychiatrist. Regular exercise can also help. Anxiety. An anxiety disorder is a condition where you experience extreme and persistent anxiety or fear in situations that would not normally cause such a strong reaction. Due to anxiety, you might avoid certain situations or places, which can further restrict your life and increase the feeling of helplessness. You may have constant worries or feel overwhelmed by negative thoughts. If you have anxiety disorder, your body can react to it in various ways, such as rapid heartbeat, sweating, trembling, or feeling faint. This is happening because your nervous system is preparing your body to fight. If you want to get rid of anxiety disorder, be physically more active, eat healthy, sleep well, sometimes go to therapy, and you will probably be okay. Bipolar disorder. If you experience extreme mood swings that include emotional highs and lows, you probably have bipolar disorder. You have these mood swings because of an imbalance in brain chemicals that are responsible for regulating mood, energy, and emotions. If someone in your family has bipolar disorder, you're at a higher risk of developing it too, so choose your family wisely. Bipolar disorder has two types of mood swings: manic and depression. During a manic episode, you might feel extremely happy, energetic, or unusually irritable. You may also have inflated self-esteem and decreased need for sleep. During a depressive episode, you might feel very sad or even hopeless. You may experience changes in appetite, sleep disturbances, fatigue, feelings of worthlessness or guilt, and even thoughts of suicide. Eating a balanced diet and engaging in regular physical activity can help stabilize your mood. Avoiding alcohol and recreational drugs is also crucial, as they can trigger mood swings. Therapy can help as well. Eating disorder. No matter how much weight you lose or gain, you always see yourself as not good enough. The mirror reflects a distorted image that fuels your insecurity and self-hatred. You're constantly battling with fear, guilt, and shame around eating. That's exactly how you would feel if you had an eating disorder. Whether you're overweight or underweight depends on the type of eating disorder you're experiencing, such as anorexia nervosa, bulimia nervosa, or binge eating disorder. Anorexia is characterized by extreme food restriction, intense fear of gaining weight, and distorted body image. Bulimia nervosa involves cycles of binge eating that trigger deep feelings of guilt or shame, leading to self-induced vomiting. Binge eating disorder is similar to bulimia. There are cycles of binge eating and also the guilt and shame afterward, but without vomiting. As a result, people with binge eating disorder are extremely overweight. Schizophrenia. Are some of your friends imaginary? Are you often experiencing hallucinations? Do you find it difficult to make decisions, focus, or remember information? Is motivation somehow hiding from you? Then you probably have schizophrenia. Schizophrenia is a serious mental health condition that affects your thoughts, feelings, and behaviors due to an imbalance of brain chemicals and structural differences in the brain. With proper treatment, you can manage your symptoms and live a fulfilling life. To cure this disorder, it's crucial to have a good sleep, a balanced diet, and regular exercise. It's also necessary to avoid alcohol and any type of drug because these guys can only worsen your situation. Neurodevelopmental disorder, language, motor skills, behavior, memory, and learning. If you have or had some problems with these, especially in your early childhood, then you may have some type of neurodevelopmental disorder. These are common types of neurodevelopmental disorders on which you can check your symptoms. Autism spectrum disorder, ASD, difficulties with social interactions, communication challenges, repetitive behaviors, and restricted interests. Attention deficit / hyperactivity disorder, ADHD, inattention, hyperactivity, and impulsivity. Intellectual disability, below average intellectual functioning. Learning disorders, for example, dyslexia or dyscalculia. Specific difficulties in reading, writing, or math. Communication disorders, problems with speech, language, and communication. To get better and relieve symptoms, you need to start social skill training, undergo therapy, or please your family to help you. And remember, the earlier you start to intervene, the better the outcome. Disruptive behavior disorders, DBD. DBDs are a group of behavioral disorders that go beyond the bounds of normal childhood behavior. These are the most common types of DBDs: oppositional defiant disorder, ODD, CD conduct disorder, intermittent explosive disorder, pyromania, and kleptomania. Oppositional defiant disorder is characterized by a consistent pattern of defiant, disobedient, and hostile behavior toward authority figures, such as parents, teachers, and other adults. Conduct disorder is a serious behavioral and emotional disorder that can occur in children and adolescents. It involves a pattern of aggressive, deceitful, or destructive behaviors that violate societal norms and the rights of others. Intermittent explosive disorder is a mental health condition characterized by sudden, brief episodes of intense, uncontrollable anger that are disproportionate to the situation. Pyromania is the impulse control disorder characterized by the purposeful setting of fires on more than one occasion. People with pyromania experience an irresistible urge to start fires and derive pleasure, gratification, or relief from doing so. Kleptomania is a mental disorder characterized by a strong urge to steal items that are not needed for personal use or for their monetary value. Kleptomaniacs feel tense before stealing and relieved or happy afterward. Thank you for watching. If you've watched this far, you'll definitely like this video too.